Hello, and very welcome to this conference about ME CFS. Can everyone hear me? Yeah, people are nodding. My name is Henrik Fransson, and I am the chairman of the ME CFS patient organization here in Stockholm. We arranged this annual conference together with our national counterpart in the nationwide ME CFS Association. The slides you just saw are examples of patients with severe ME CFS. And according to a recent report from American Institute of Medicine, about 25% of the patients are in this state of disability. The patients are, as you could see, housebound or bedbound and can most often not even visit their doctor. The patients are often forgotten by the society and the medical profession, and that's why we this year put focus on this group with this conference. One doctor once told me that ME CFS must be the only illness where the most severely ill patients get the smallest amount of care, and I can only agree with him, sadly. My personal story of ME CFS began in 2009 when my wife Karin suddenly started to have fever, flu-like symptoms, and a devastating fatigue, causing her to hardly be able to sit up or even speak during the symptom flares. Every time she performed some kind of physical effort, the fatigue, pain, and fever and feeling of illness skyrocketed, and she had to lie in bed for several days to be able to recover. And this was a tremendous change compared to the life she had before the illness onset, where she had been a very active person with running, bicycling, skiing, and performing a lot of other activities, also hiking and physical activities. All doctors she met concluded that something must be wrong, but no one could figure out what it was. So 2 years passed, and then suddenly she met a doctor that said, "Hey, I recognize this condition. Maybe it could be ME CFS." So the doctor started to do investigations, and after a few months he concluded that this is ME CFS. And 2 years is quite short time to get a diagnosis in Sweden for ME. Normally it could take up to 10 years or even longer to get the correct diagnosis. Unfortunately, her condition has become worse and worse over the years, and since 2011 she is almost completely bedbound. She can only be up from her bed a few minutes per day. Her social life is reduced, and occasional visits by close friends and family is reduced to occasional visits by close friends and family, but only for a few minutes at a time. And I take care of all the contacts with the healthcare system and with the society, and we are forced to use home service care to be able for me to be able to fulfill my full-time work. And our relationship has been put on hold, and there is no possibility to get children or do anything a normal couple would do. Once I realized the lack of knowledge and understanding amongst clinicians and the public and the lack of available care to these patients, I decided to join the ME CFS Association, and that's why we are all here today. Today we will listen to talks by international specialists in ME CFS. First we will listen to Dr. Dan Peterson from Seminarium Research in the USA. Then we will listen to Professor Mehdi Hornig from Columbia University, USA, Professor Lena Jason from DePaul University Medical Center in the USA, and Dr. Lena Nilsson from the ME CFS clinic here in Stockholm. Lena Jason's presentation will be performed over a live video feed through Skype, and we are keeping our thumbs crossed that everything will work. As a moderator, we see Michelle Silvestri, who is sitting here, is a lecturer at the Karolinska Institute here in Stockholm, and also a politician in the Stockholm County Council.